My name is Tricia Anderson. I'm chair of the board for Quinte Healthcare. And what I love about our plan is that it was really informed by so much input, not only from our community, but our other health service providers. The community has asked us to focus on 24-hour ER, emergency care. They've asked us to focus on diagnostics. They've asked us to focus on appropriate clinical services. So we have reached within the board and through our consultations within our staff, we've reached what I think is a plan that addresses each of those items. And more importantly, I think it's actually taken it to the next step in the sense that we're also supporting the recommendation that came out of the advisory committee from the Brighton Quinte West group. And that is, let's focus on primary care, because clearly that's what we need to focus on in each of our communities. If we have strong primary care, the rest of this plan falls naturally into place. We are committed as a board to making sure there are 4 hospitals with appropriate levels of services at each of them, that the ERs are there to stay. Trenton Memorial is there to stay. It's part of what I see as the future for Trenton.
Right.
There is no hospital within Quinte Healthcare Corporation that is in danger of closing. Our community has come out very strongly and said they want an ER, a 24-hour ER at each location. It's clearly a concern of theirs, and it is a service that I believe they require. So we are committed as a board to make sure that those ERs are always operating.
Okay.
As chair of QHC, and more importantly as a resident of Quinte West, as a member of this community who works and lives here and has a family and is raising it, I'm very aware of the level of change that's going on within our organization in order to be more cost effective, to come in line with some of our funding models. I'm also aware of the fear that some of those changes are raising in the community, and probably the environment of unrest within our hospitals as well with respect to our staff and our volunteer. I would like to thank them very much, because we could not have come forward with the operating plan that we are proposing this year without the dedication of the staff who deliver quality of patient care every single day. I hear story after story of just what a wonderful job our staff do. We have such thankful patients, and we have a very strong community who believes passionately in our hospitals. So I thank them as well, and I'm calling on our staff, I'm calling on our volunteers, I'm calling on our community to come with us and move our model of healthcare for our community forward, so that we can be the leader of some of the changes that are happening within not only our community but also within our LHIN. There's some wonderful opportunities for us to get ahead of the curve, to define what healthcare is going to be in our area, and I would love for that passionate community, that passionate staff, that passionate volunteer base to come with us on that journey and help us move that forward. It can't be done without them, and we wouldn't want to go there without them. So I'm asking them to join us.